Hi guys, welcome to our live stream, the first one coming from the What is Wellness series at TruthPie. I'm Joanna Rennie, I am the director at TruthPie, and these are some of my lovely practitioners that I work with, very talented people. So we are coming live today so that we can talk to you about the question, what is wellness? I think that means a different thing to each one of these guys that are with me, and probably a different thing to each of you guys watching. So I think, first of all, I'll start off by introducing everybody we've got here, and then we can go around, find a little bit more about their therapies, their practices, and what they do, so that you can have a better understanding of what they do as well. And then we can go in and have a chat about that question, the big question: what is well-being? What is wellness? So we'll start off with Matt Fenimore. Matt Fenimore is a clinical massage therapist at TruthPie. He has been with us since November, I believe, of 2019. We have Eric Jumper Anderson, who is a Tibetan medicine practitioner. Eric joined us earlier in the year, just before we all went into lockdown. So he's recently started his practice in Bermondsey with us just 2 weeks ago.
Yeah,
3 weeks ago. And then we have Jenny Tamai, who is a nutritional therapist. Jenny joined us over the summer as well, and is going online for most of her services at the moment. But she'd love to be doing some in-person talks and seminars and things. So as soon as we're open for group seminars, she will be involved doing that. So first of all, I'd maybe like to get you guys to introduce yourselves and let us know a little bit more about your background. So Matt, do you want to start off and let us know about your experience?
Sure, yeah. I'm Matt Fenimore, Active Release Therapies. I trained in clinical and sports massage. So a lot of people know what sports massage is, but they don't tend to it doesn't really trip off the tongue easily. Clinical massage, it sounds kind of very cold, but it's just a phrase to just to be more direct and just to work with people on a particular outcome. So I trained at a place in Brighton called Jing. So I trained for 3 years. So as well as doing the kind of traditional sports course, you also work on a range of Eastern and Western traditions as well. So you'll do the physiotherapy stuff like orthopedic assessment, orthopedic testing, plus you also do the acupressure points, you do the Thai stretching. So it's like a big box of different things that you can apply to the person depending on what is agreed at a consultation. So although, nominally sports massage therapies, but with clinical massage side of things, it's to do a lot with pathologies. So people know if they have an ache or a sprain or something's not quite right, and they have little niggles, and that's kind of sorted with some massage. But there's also some very systemic things, which means that it could be to do with like traumas and things that have manifested themselves over years. So that's why I'm very much interested in, trauma with a small t, because, if you've fallen off a horse, you've fallen out of a window, if you've been in a car accident, there's the body keeps a score of many of these things. And sometimes we disconnect with the bodies and we don't kind of realize. So one of the points of clinical massage therapy is to work on those kind of musculoskeletal, but also the systemic things. So systemic things might be things that don't have a particular cause, but might be migraines or tinnitus or vertigo or carpal tunnel syndrome, RSI, all these things that are often linked, 99% are linked with the body psychosocial dynamic and what's going on with the brain and the stress levels. So yeah.
Right. Okay. And how would you Is that how you would kind of find out about someone having had trauma? Is it normally that you consult with them and they tell you about that, or is it that you can just see that in the body, the fact that they're having migraines? Are those signals for you?
Yeah, I mean, it's a mixture of those things. You do body readings from the moment somebody walked into the room, so you train in body reading. But also, you know, some people may not. You've got to build the therapeutic alliance, so people may not be open to you when they first come to see you, especially if they're just coming for one treatment. It might mean treatment 3 or 4. They could suddenly say, "Oh, actually, yeah, I did fall off a horse when I was 13, but I didn't think anything about it at the time."
Right.
So that comes with, you know, a very in-depth kind of consultation at the beginning. So you'll be looking at the kind of medical history of what's happened, and that's just really important with clinical massage, as opposed to, you know, just taking a few details of what's your pain level at the moment. There's some very kind of systemic things that have been perhaps hanging around for a while that haven't been addressed, you know. So people will say, "Oh yeah, I did fall off a horse, but I didn't think it didn't affect me."
Okay. So you're looking back at things that have happened many years ago, sometimes people maybe even in childhood, and it's still affecting their bodies.
Yes, exactly.
And mind as well. Do you talk to them about how that's affecting their mental health as
Absolutely.
well?
You know, certainly you will ask questions of them, you know, so how do you think this is manifesting itself in your body? So you've had this chronic pain for 6 months and it's never gone away. What are your sleeping patterns like? What are your stress levels like? Is your support network? How is your family? Is your partner supportive of your pain? What are your responsibilities at home? Do you get any free time? All these things. So it's a safe space for people to come and build that relationship, so they feel that they can open up, and you can start chipping away at, you know, things that have manifested themselves over a while. Not always. Sometimes, yeah, it's my hamstrings are tight. And you know, you work, but a lot of clinical massage is about the fascia, the connective tissue. So obviously fascia, the body keeps the score. So I remember chatting to Liz, body psychotherapy, at one point, because she recommended the book, but we just, as you do in the corridor, you start talking about fascia. And she recommends this book, and you know, and she's so totally in agreement, because that's what happens. So you've got to, you know, have a look at what the underlying causes of these things are before you can begin to help and repair, and you know. So fascia. It's all about fascia.
It's all about fascia. Fascia, not fashion. We're about fascia here at TruthPie.
So somebody could
in a session, what are you expecting to do with your client? What if someone's come to you, they've never had clinical massage before, maybe never even had a massage before? What are they actually expecting from the time they get in the room to happen?
Weirdly, I've seen a few people recently who have never had a massage in their life, which was quite weird, you know. So you feel very, you feel very, you feel very privileged. But so when people come, it's first of all obviously putting them at ease and asking all those right questions. But it really is the in-depth consultation is the important thing. And what we'll do is set some benchmarks. So what do you want out of this session? Do you want an increased range of motion? Do you want to feel less stressed? Do you want to reduce your pain? So it's clinical massage just means being able to benchmark those things. Because if you see, I'm sure the other practitioners would agree, if you see somebody once, so if it's like acupuncture, it's a systemic thing. You're working on, you know, in Western medicine, we just deal with the thing that hurts. But over time, you know, if people come more than once, then you're working on other parts of the system. So, I think with hopefully wearing my learning lightly, and I get a lot of good feedback, but it's also educating people about their own bodies as well, you know, so that they can make the decision. They can have a narrative for their pain. That then they feel in control of that, because as I don't want it to be, I want it to be symbiotic. I don't want to be, it's something that I do to you all the time. It needs to be a therapeutic alliance that we're both working together to sort out this particular issue.
Yeah, teamwork is very important, isn't it, in the therapeutic relationship? And I think often when people do seek out therapists, they ask what do they do, and actually it's that they work with you to support you, rather than work on you or solve something for you. It's sort of a work in progress a lot of the time for throughout your life, really. There's constantly things to be able to look after. Okay, thank you, Matt. I'm gonna go on and explore some other therapists and what they're doing as well, and then we can come back and have a chat together too. So I'm going to jump in with Eric first of all. So Eric is our Tibetan medicine practitioner, and you can tell us more, actually, all about where you're from and the exciting things like that.
Thank you. My name is Eric Champa Anderson, and I'm a Tibetan medicine practitioner, which I know means probably fairly little to the majority of people watching. I've been studying and practicing Tibetan medicine for the past 10 years. I grew up as a part of a Tibetan Buddhist community and was always sort of around Tibetan medicine and had used it and benefited from it when I was younger. And eventually, when the opportunity arose to be able to study it and actually become a practitioner, I jumped on it, jumped on the opportunity, and here I am. I'm obviously from the US. I'm not from the UK, but I live here now. So I'm here locally in Bermondsey, and I'm very excited to be with TruthPie, offering Tibetan medicine consultations. I studied mostly in the United States with a couple of different schools. Traditional 4.5-year, 5-year training in theoretical studies. And then I spent half a year in Nepal for my clinical internship. And I've had sort of ongoing training since then. And I also teach. I'm the director of Srimala Healing Arts, which is sort of my clinic through TruthPie. And then also Surat Kong London, which is an educational institute for Tibetan medicine.
Cool. Amazing. So what you've got, you've got a vast amount of experience. I know this, but and I know that you also do lots of other things. So you do some astrology and you do lots of different things make up your program of sort of consultations. If someone was coming to you for Tibetan medicine sessions with you, what are they expecting to happen in that session?
Yeah, so with Tibetan medicine, basically a consultation involves traditional diagnostics, which are primarily pulse analysis, urine analysis, and then also like tongue analysis and analysis of different features of the body, and then also discussion of symptoms, personal medical histories, and so on. So based on that, we develop a sort of holistic health plan that involves diet and behavioral modifications, herbal therapies, which are sort of one of the primary things that I focus on. I make all of my herbal formulas. I used to work with a pharmacy in Nepal, but in the UK, regulations are a little bit different, which is actually really great because it's giving me the opportunity to produce my own medicines. I grow and wildcraft a number of the ingredients that I use, but I have a pretty extensive pharmacy that I work with that's all based in traditional formulas. So that's the majority of what happens in a session. For my new client consultations, it's an hour and a half that we spend together, and it's really quite comprehensive. Sort of like Matt was saying, there's so many factors that go into someone's experience of health or dis-ease. And a lot of those things are outside of the realm of what we even sort of consciously realize is affecting us. It can be old trauma. It can be really sort of chronic, latent sorts of issues that are bubbling beneath the surface that we aren't really privy to. And it can also be, aspects of our daily lives that we don't really think about as being something that impacts our health. So it's really important to have that time to be able to, really delve into some of the depths of our experience and also go beyond just the level of sort of physical wellness. I think a lot of people are familiar with the idea of, holistic medicine being something that integrates, mind and body. And especially with the Tibetan tradition, that's really quite important. But there's also a sort of third paradigm of the level of energy. So we often speak about these sorts of three doors of body, speech, and mind, or body, energy, and mind. And these are really different, sort of continuums through which we experience health and disorders. And you have to address each of those, otherwise you won't have really, concrete, lasting change and improvement.
And what are you expecting people to take away from in the short term, if they just came to see you on sort of for a session or a couple of sessions? And what would you expect them to take away if they came to see you on a longer term basis?
Yeah, so I mean, Tibetan medicine in the Himalayas, in Nepal and Bhutan, northern India, and Tibet, including sort of Tibetan regions of China. China has occupied Tibet for the past 60, 70 years. Tibetan medicine really is a primary medical modality. People will go to a Tibetan medical hospital in order to get various treatments for different disorders. In Nepal, when I was working in the clinic there, it was literally people with every manner of disease or trauma, any kinds of issues were treated in-house through traditional Tibetan medicine. So it can be sort of, it can be a medical system for those sorts of things. It can also be something that addresses more chronic long-term sorts of issues. At least in the US, like 45% of the American population has at least one chronic disorder that they are being treated for if they have the money to be able to afford it. And I don't think it's so different in the UK. We have a lot of chronic disease. So, for people who have something really acute, somewhat minor, you have a cold, though at the moment, if you have a cold, maybe don't come to us. But in normal circumstances, sort of more acute issues, you can see good results from just one session. But in most cases, it's really helpful to have more long-term sorts of arrangements. So usually over 3 months, sometimes after just a month or two, sometimes 6 months or more, you can see a lot of improvement in a lot of different areas of your health and begin to realize how those different areas of your health were actually intertwined the entire time. And when you take care of something on a more systemic level, all of those tiny little eruptions in different areas of our experience of wellness start to calm.
I love that we all at some point get to the point in our questions where we say, it's all one, it's all linked up, because it's so true. And I think that's a really good point. So I'm going to move to Jenny now, just while we've kind of all got to the same point, and then we can come back to each other. Jenny is our nutritional therapist. She's doing some online sessions with us, and she did a wonderful gut health and your immune system workshop last month, didn't you? Which is soon going to be available to purchase from our website as well as a recording. Jenny, talk to us about your practice and what you offer to your clients.
Yeah, sure. Thank you. And so, I'm a nutritional therapist, and I'm also a personal trainer as well. So I do that. I'm very into my fitness. So I love my fitness as well. So I help, my main speciality is that I help clients come away from eating distress, so of yo-yo dieting, helping clients establish that healthy relationship with food. I recently just qualified from the National Centre for Eating Disorders. So I'm now, starting to work with eating disorder clients, which is really great. It's something that I love to do. And that's my main specialty at the moment. And also gut health as well. I'm really passionate about the kind of gut-brain sort of connection, all the links there that you guys are talking about, like trauma as well. That can, you can store trauma in the gut as well. So I'm really passionate about, getting to the root cause of disease, which is most of the time down to gut.
Yeah, a lot of the time. And you talk about we've talked about doing multitude of workshops, haven't we, just based on around gut health, because there's so much to talk about on that subject. If you were working with sort of one-to-one clients, is that something you spend a lot of time focusing on, or is it generally, are you talking about their sort of ongoing diets or their relationship with food? Where do you sit in that sort of world of nutrition?
It's mostly the relationship with food. I mean, especially now during COVID, like people's relationship with food has, you know, unfortunately, you know, it's gone out of control for a lot of people. And, you know, eating sort of disorders are on the rise. You know, people have been relapsing due to COVID because there's so much uncertainty. They don't feel like they've got control. And it's, you know, it's a really worrying sort of thing. And it's something that I really am passionate about, helping people to gain back control, and helping to establish that healthy relationship with food. And that's what I focus on in one-on-one sessions. And I also like to address social media as well, because I deal with a lot of women who are on social media and they're scrolling down a lot of social media, and there's a lot of content on there that's focused around weight loss at the moment. And you know, that's the big thing when you're constantly scrolling down Instagram and, you know, someone hasn't got that healthy relationship with food, they're constantly being triggered by what they're seeing on social media. And I think it's a big thing, and working on sort of body image as well. So following people who, you know, post content that is geared towards body positivity. And so I touch on that as well. I think that's an important part.
And how would you, or are you able to even talk about to us about how you would encourage that body positivity with people? Because obviously, I guess that's quite a personal thing to each client.
Yeah, it depends. There's certain questions that I ask for that, and there's certain exercises that I can give for that, and to help establish, you know, better sort of body image relationship there. And also, I ask who they follow on social media. I ask what their content is, and then I try and give suggestions of like who they should be following, and like if they find content is not serving them or not making them feel any better about themselves, you know, just unfollow those people.
If there's anyone sort of listening to this who's thinking, actually, you know, I sometimes feel that way when I'm looking at social media. Obviously, they might get in touch with you and organise a session to maybe just open conversation. Do you have sort of a consultation, don't you, just to chat through about what you do if someone wanted to talk to you? But also, if someone was thinking, I know somebody who might benefit from talking to you, and is there a way that they could approach that person about having sessions with you, or do you always feel like it's something that someone has to find on their own?
No, it's a really good question. I think it's good if someone comes and finds it on their own, but I do think always you do need that little bit of nudge from someone sometimes, which I think is fine. But it's really good to come with your own sort of initiative as well to a session, which is good.
Yeah. So maybe even is that, you know, finding a way for them to introduce what you do to the person, as opposed to introduce, you know, it as an option for them to take up, if you know, if they're worrying about somebody's mental health around their body image, for example, then they might want to introduce what you do as a subject. You have a really good blog, don't you, on your website with some lovely advice on there. That might be a nice page for people to visit. In fact, I think all of you have your own websites, don't you, on here that you have content on. So I'll pop those links in wherever I post this afterwards, just so if anybody does want to go and have a look and maybe refer people to blog pages that might introduce therapies to other people that they know that might be interested in speaking to any of these guys, then that will be available. So we're here really to discuss as well what is well-being, aren't we? So what is wellness? I know Eric was really keen to answer this, so I'm going to start off out of order and go and ask Eric, what is wellness to you, and where do you feel like your therapy and your practice sits within the well-being industry?
So, yeah, I think that wellness is, I think it's a difficult term to use sometimes because so many people have a very specific sort of reaction to it. I think it's been it's sort of pulled into the consumerist sort of capitalist, sphere to a really extreme degree. And at this point, I think a lot of folks just have a bad taste in their mouths when they hear it. I also think it's been really watered down, but it's also central to, what all of us do. And I think it's really central to living a good life in the first place. So I hope that we can reclaim it, and hopefully through like these sorts of conversations, we can start to actually do that. From a Tibetan medicine perspective, wellness is very essentially a state of balance between your body, your energy, and your mind. So each of those have their own sorts of paradigms. From a bodily perspective, you need to have balance amongst the 7 bodily constituents, which are the various tissues of the body, different organs, making sure that everything is working together in a really harmonious sort of way. On an energetic level, we talk about like the humors, the nyepa in Tibetan, or the doshas in Ayurveda. We use the same doshic system as they do in Ayurveda. So looking at the balance between the sorts of physiological functions of the body, the motility factor with wind, the heat component of bile, the more phlegmatic sort of lubricating and cooling quality of phlegm, and making sure that those are in a state of balance. And then also looking at the mind, looking at our psychological and emotional equilibrium, and finding that is also in a state of balance. So when we have balance in each of those 3 sorts of realms, then we can experience a state of being in our sort of natural state without disease. They call it tamel neme in Tibetan, which is literally just like naturalness without disease. But then when we lose that, when we become imbalanced through improper diet, improper behavior, sometimes external sorts of provocations, such as viruses that arise and, upend everything that we have as a species. All of these things can really compromise our experience of wellness. And then we have to try to regain it through proper diet, proper lifestyle, herbal remedies, external therapies, and things like that. So I think wellness, it's being without disease, but it's also a really dynamic state of resilient sort of equilibrium on all of these different levels of our being. So we're physically resilient, we're energetically balanced, and we're psychologically happy. We're psychologically in a state where we feel good in our skin, and we feel like we have purpose and an ability to sort of go through our day-to-day lives.
I want to feel like that wellness. That sounds lovely, doesn't it?
I know.
How do you bring that wellness to your clients, Matt? How would you? In fact, all of you, at TruthPie, we're quite from the day one, we've wanted to help people build programs that support them on all of this, this sort of connected level, I guess. It's and I wonder how you guys would feel working with each other. Are there particular practitioners that you do or would work well alongside for clients to help to try and talk to them about their wellness on all of these different sort of paths?
Well, I think obviously the ethics of TruthPie is the whole is greater than the sum of its parts, and that runs through the whole things that TruthPie do. So we have a Hippocratic oath when we're practitioners that if there's something that we don't quite know or can't help them with, maybe I would refer to Jenny or I'd refer to Eric, because it's not in my area of expertise. And I think that that's something that somebody could help with, especially when you're talking about I like it when I give a stomach massage and all the serotonins go and people feel chilled, and I know it's producing certain chemicals that feel good. But beyond that, it would need an expert to kind of take that further. So I think the main thing is that we're forgetting in all this, we're forgetting like the power of touch, because I think touch therapy is a poor relation to talk therapy sometimes, or other therapies. It's not really seen in the same vein, personally for me. So for me, I want to kind of put it out there on the map to say, yes, of course the others are important, of course they are, but also touch therapy is really, really important in getting the whole body, the sum of the parts. Also, I don't know if you guys saw Radio 4 are doing a series called the Alchemy of Touch at the moment as well. So it's like 15 minutes, so we're all, with lockdown, with COVID, with all these things, we're missing that touch, and we're missing those things that can help us. So we're missing a little ingredient, I think. So if we can marry all those things back up, yes, we can work on the physical, and we can work on the biopsychosocial dynamic. But at the end of the day, we need to be touched, and we need to be felt and held, and all those kind of things. So there's lots of strange things going on, isn't there? So all those are part of the whole for me. So for me, that's what wellness is, and I think Eric's right. It's been cheapened a little, or it's been made kind of quite consumer, like holistic, taking off the W. The W's there because it's whole. We are whole. So don't take the W off.
I love that, and I think you're right. Yeah, definitely the touch thing is so important, and people are really sometimes you're right. I as a bodywork practitioner myself, I think people do come to us when they just want to relax and don't actually want to talk about how healthy they're feeling. And sometimes when you I do clinical aromatherapy, if you're a clinical practitioner and you're sort of looking at people's history, and you are looking at maybe helping them more in a longer term, it sometimes can be difficult to say, oh, they're just here to come and relax for 1 hour. But it's remembering as well that moment of touch that day for them might then open up some wonderful, emotional state, energetic state, other sort of physical benefits for that week that they haven't even considered. So, I know you're passionate about every single client that comes in. So, it's that giving everything you can to that person that's come into your room, even if it's 1 hour out of the whole year or ever. The same as you'd give to somebody who is coming to see you every single week. Jenny, what is well-being to you? What is wellness? What does that mean to you, that word?
For me personally, I think it's reaching a state of calm, just a sense of just calm. I think so many people are just, especially now, we're very stressed out. They're very anxious. Anxiety and depression is on the rise right now, and I think that reaching that kind of state of just calm is just a part of wellness for me, and happiness as well. So I'm big on the whole kind of mind body sort of aspect, but I think it's really important just to have that space in your head and free your mind, and I think that's a massive part of wellness, just to have space in your head, not to have and just be content.
Perfect. That sounds also lovely. I'm going to come to treatments with you all after this soon. I just feel like as soon as I talk to any of you, I just want to book in. Well, thank you so much. I think that's kind of rounded up everything we want to share today with everybody. Has anyone got anything else they would like to add to the conversation today? I think that's everything, right? So I feel like we just wanted to make sure that we had a space, had opened the start of this platform where we can share with everybody more about what we're doing, and get you sort of on the same page as us and understanding truly what is behind all of these practices, especially when they are not quite as mainstream. I'm sure, like Eric said, many of you might not have known at all what Tibetan medicine was before this conversation. And I think it's really important that we took the time to have a chat with you guys, and thank you so much for spending time with us today and hearing us gabble on, especially me, because I just keep going. So thank you so much. I hope you take a lot away from this, and I wish you all to find your wellness going forward.
Really, all of us.
Good night.
Good night.
Bye.
Thank you.
Bye. Thank you.